A health nonprofit says 1 in 4 Virginians are not taking their medicines as prescribed because they can't afford it. Medical professionals in the Commonwealth are pushing to create a board to change that. It's not a new idea, but it is back in front of the General Assembly this year. Sarah Hammond joins us in the studio with details. Sarah.
Well, the Committee to Protect Healthcare says they're passionate about getting this board in place in Virginia for one big reason. Even though Virginians spend less on average to see their doctors or providers, they're spending about 36% more than the national average on prescription medications. A group of doctors said on Monday they've seen this scenario play out too many times. A patient needs a certain prescription to keep pain in check or cure an illness, but that drug is just too expensive.
I've had patients say they'll take their chances with cheaper, less effective alternatives.
Dr. Rahman Ahmad, a pain management specialist, is just one of more than 100 Virginia medical professionals to sign a letter supporting the creation of a board they say will keep those prices in check.
Virginians deserve better than to roll the dice with their health care just because of high drug costs.
Right now, there are 2 bipartisan bills in the General Assembly waiting for a vote to decide if the Prescription Drug Affordability Board will be created. The board would review the cost of certain prescription drugs and decide if manufacturers are charging too much and then set a price cap, something Dr. Greg Gelberd says is necessary.
No one should get rich on a sick person.
Dr. Rochelle Klinger, a psychiatrist, says when it comes to behavioral health, those patients are struggling to afford their long-term medications.
Unfortunately, they are often not covered by insurance or have unaffordable copays ranging from $400 to $1,500 a month.
This is not the first time creating this board is up for a vote in the General Assembly. Last year, a similar measure was passed in the Senate but failed in the Republican-controlled House.
Establishing a review panel will send a clear signal that Virginia puts people first.
While the committee says they are not sure how long it would take to stand the board up if approved, but they look to Colorado as an example. They say leaders in that state were able to get their affordability board going 2 years after it was approved.